First off, can you break down the numbers for us? How many of those admitted are mild cases, moderate cases, and severe?
We don't admit mild and we don't admit moderate cases. We admit severe and critical cases only. And even at that, our COVID floor, which has 30 beds, and our ICU beds for COVID is right now at 12, um, not including the ones in the ER. They're all full.
What then happens to those who are not severe cases or critical cases? What do you recommend that they do? Do you just recommend like a home therapy with a home quarantine, or do you send them to local isolation facilities? Can you give us an idea of how this works?
Yes, the mild cases can actually stay at home and have themselves monitored. Those who have some degree of pneumonia, which are those with moderate disease, can be X-rayed, and they can also stay at home and also take medicines and be closely monitored by their doctors. Um, I'm sorry to say that we don't have a lot of space for them because at this point, even the emergency room is full of critical COVID patients. Our ER has become an ICU as well. There are intubated patients there. So it is the last place that you want to be if you have pneumonia or if you have COVID.
All right, but what home remedies, or not to say that these are not medical remedies, but what should people follow if they are asked to isolate at home and self-quarantine at home? Is there a proper way to do this, upon doctor's orders, of course?
Well, the first thing you need to do is to buy a self-monitoring device that can track your oxygen saturation, your blood pressure, and your pulse rate. And those are very easy they're cheap. Also to track your temperature. You should chart your all of these vital signs at least twice a day. Make sure that they are within the normal range, and make sure that you can then call a doctor whenever they become abnormal. Just like any viral disease, you need to keep yourself well hydrated. You need to control the temperature if you have fever and the body aches with analgesics. You need to eat right and eat healthy foods. And by all means, if you can exercise, you should do that even if you have mild disease. It's important to keep a positive outlook as well and try to stay connected with your friends and relatives through Viber or whatever social media is available, because that is also important.
All right, thank you for that advice, and it's a pretty well-rounded advice at that, Doc. Any thoughts on the calls for another timeout made by a group of health workers? Are you personally in favor of this? Because it seems the medical community as a whole is split on this particular issue of a timeout.
There are many disadvantages to actually having a total lockdown. I think the government is taking the correct steps in increasing distancing and making sure that there are enough opportunities for people to stay apart. I think that we can do more in terms of staggered work hours, so people don't have to crowd the transportation system. Remember that even if those who are critical is only 2% of the entire new cases every day. If you have 8,000 new cases every day, that's 160 critical cases being dumped into the healthcare system on a daily basis. So it's important to bear in mind that we should all follow the government's directives. We don't, as far as I'm concerned, I don't advocate a total lockdown, but I think everything starts with discipline and with making sure that we are far apart, while in order to show solidarity with the rest of the country.
All right, and having said all of that, Dr. Jose, do you think that the NCR Plus bubble, which is in effect starting this week, do you think it's effective from your perspective? Where does this transmission usually happen? I'm assuming workplaces, public transportation, and the home.
It's hard to say at this point because the effects will only be probably apparent at least 2 weeks from now. Um, it takes about 2 weeks for patients with critical COVID to get well, so that before they are discharged from the hospital, that it takes about 2 weeks to 4 weeks. So it's hard to say at this point whether it will work. I think that it's important also that people get vaccinated as soon as possible, and that the vaccination should start not just with healthcare workers, but also with the vulnerable elderly, because these are the ones who go into critical disease.
All right, that is noted, Doc. Speaking of the vaccinations, how is the vaccine drive going in Asian Hospital? Have you been able to vaccinate all your healthcare workers so far?
So far, we have vaccinated 87% of our employees. And as far as our doctors are concerned, we have also vaccinated more than 80% of our doctors. And it's a very heartening that there are also doctors from other places who are contacting us for vaccinations should we have excess doses.
All right, that's very good to hear. And I guess one last question before we let you go. Do you agree that Metro Manila should be prioritized in terms of vaccination because of the surge that is largely being noted here in the nation's capital? Of course, they plan to redeploy the vaccines that are meant to go to other provinces back to the national capital. For you, is this a wise move?
We haven't really penetrated the healthcare workers as far as I'm concerned, because there are so many healthcare workers who have not yet been vaccinated. At this point, the government is relying on hospitals to vaccinate. But there are many healthcare workers who are not affiliated with any hospital. And so therefore they remain unvaccinated. I think that we should first saturate the national capital region in terms of vaccination, since this is where the pandemic is really raging at this point.
All right, thank you so much for answering our questions very clearly, and thank you for your time and your insights, Dr. Jose Acun, Chief of the Asian Hospital and Medical Center. Thank you for your time.